I want to bring back in Jim Himes, who I think joins us now. He's the 4th District Congressman. Congressman, are you there?
Hi, John. Yes, I am.
Hi. Thanks so much for joining us. I appreciate it. Bill Curry's making the case that the fragile economy is what's really at stake here. Is that what you're most concerned about in these sequester cuts, the state of the economy, or are there real things on the ground in Connecticut that you have to be concerned about as well?
Well, those two are often the same thing, John, and I think Bill got it just about right. I think, look, there's two big problems with the sequester. One is what Bill was just outlining, which is that this will have a detrimental effect on the economy, which is recovering, but recovering in a very delicate way. Look, the CBO, which is, beyond partisan manipulation, has said that the sequesters, will shortly over time result in about the loss of 700,000 jobs. That's just a terrible idea at any time, much less one when the economy is recovering in very delicate fashion. The other issue, which hasn't come up all that much in the conversation this morning, John, is, although Bill alludes to it, is that in some ways this is a monumental distraction from where, topics number 1, 2, and 3 for those who are serious about putting the federal budget on a sustainable path in the long run, which of course is rising healthcare costs. And by the way, that's true of the state of Connecticut, and that's true of every business, small and large. It's not the only thing. Bill didn't mention that another area of the budget that has grown dramatically in the last 10 years has been defense. There's an awful lot of spending there, and frankly, wasteful spending there. And Bill didn't mention, I think because he was rightly focused on healthcare costs and Social Security and Medicare, that our tax collection, although this is changing, is a smaller percentage of GDP than it has been since Eisenhower was president. But really, topics number 1, 2, and 3 have got to be reducing the cost of health care over time if we're serious about this challenge. And of course, the sequester doesn't even mention that.
Of course, one of the arguments for people who are trying to put more of the blame for this at the feet of the Obama administration is that President Obama, when he took office, took on health care, but he took on health care access. The cost piece of this has not, as you say, necessarily been dealt with. This isn't to ask about blame, Jim Himes, but it's really about how do we move forward. Essentially, tackling health care costs is the biggest thing that you and many others can agree is the problem. But how do we even begin to have another conversation about health care costs, given the bruising battle we had over what we now call Obamacare and health care access?
Well, it's very hard, and blame is not the right way to frame it, of course. And in fact, if you want to sort of ascribe credit or blame to the Obama administration, the reality is that the healthcare reform, put in place 24 measures which over time are expected to reduce the cost, to slow the growth in the cost of healthcare. Hitting emergency rooms and hospitals with penalties if they don't treat somebody who shows up in their emergency room, day in and day out, bundling expenses. Lots of technical fixes were included in the healthcare reform, and economists tell us that part of the reason that in the last 3 years we've seen a meaningful slowing in the increase in the cost of health care is partly attributable to that. But, John, your larger question is exactly right. Look, we know what the answers are, and some are reasonably easy to talk about from a policy standpoint, some are not. Bidding for medical equipment, bundling services in such a way that hospitals and doctors are told, look, for a patient with, who has appendicitis, as I did 7 years ago, instead of being paid for every pill, for every procedure, for everything you do, we are going to give you one lump sum payment. That totally changes the economics, whereby now providers are incentivized to do efficient and good care rather than lots of care. So, those are the discussions we need to have, as are, how to make for a healthier American population, how to deal with defensive medicine. But your question stands. Healthcare is, as we learned, enormously emotional, enormously personal to people. But if we are going to be serious about getting our country and state and, frankly, municipalities and businesses on sustainable fiscal paths, that will be the conversation we have. Not, TSA operators in airports, not whether, this loophole for $3 billion should be taken out of the tax code. That's all worthy discussion. But it's almost, I don't want to say irrelevant, but it's marginal relative to reducing healthcare costs.
Now, obviously, you're talking about the long-term impacts here, Jim Himes. Just before I let you go, maybe you can give us one very specific thing in your district that you're looking at that's going to have a short-term impact as these cuts take effect.
Well, in the short term, we're going to, I think in my district, the 4th District of Connecticut, we're going to observe fairly quickly, a lot of inconveniences. People who travel will notice delays in airports. I actually shouldn't, there will be inconveniences, plus there will be real damage done. Head Start programs, which provide early child care education in Bridgeport, Stamford, Norwalk, and elsewhere, they're going to need to furlough teachers. That's going to mean fewer children in those very risky programs. I will point out, John, that there are other parts of the country that will be much more dramatically affected. Northern Virginia, where there has been such growth in security and defense spending, which is a whole other topic, could very well be devastated. The Pentagon has said that if the sequester continues into April and May, they are likely to furlough most, if not all, of their civilian employees. Now, Connecticut will be affected by that, not nearly as dramatically as Virginia will be, but I think what you're likely to see here, John, is sort of inconveniences and problems that build over time into a really negative event eventually, or I shouldn't say event, but it's really negative economic consequences over time.
Jim Himes is a Democratic congressman who represents the 4th District. We got him today on a train, so thanks so much for joining us today, Congressman. I appreciate your time.
Thank you very much, John. Take care.